Hello, everyone. My name is PI Chair Salimifard. I'm a postdoctoral fellow from Harvard THN School of Public Health. And today I'm going to present our paper on health co-benefits projection of energy conservation pathways, bringing health into climate action policy planning. My colleagues and co-authors in this study are Marisa Van from University of Washington, Jonathan Buenicker, research scientist from Harvard THN School of Public Health, and Joseph Allen, associate professor from Harvard THN School of Public Health. So we know that building sector is the largest energy consuming sector. In the US, we have about 40% of the total primary energy consumption in the buildings. And in terms of emissions, buildings are also large contributors to greenhouse gas emissions. In the US nationwide, we have about 27% of greenhouse gas emissions from energy used in buildings. And that number for urban regions like New York City is even much higher. In New York City, in the same year of 2017, we had 73% of greenhouse gases from energy used in buildings. So that sets the motivation for co-benefits of built environment, or COBE project. The premise behind co-benefits analysis is that by making a sector such as buildings more energy efficient, we are reducing their demand of energy from generation and distribution. Therefore, on the energy supply side, such as in power plants where it is generated, less combustion of fuels are required, and we have fewer emissions. From the reduction in the emissions, we have averted criteria air pollutants, which cause health impacts. And these pollutants are like NOx and SO2 and PM2.5 and ozone. And less of these pollutants being emitted results in less exposure to them and therefore health co-benefits. Reduction of energy use and demand can also lead to reduction of greenhouse gas emissions such as CO2, methane, and N2O, which derive climate benefits. We have done several health co-benefits assessment studies on different energy scenarios and policies. And recently, we conducted a historical assessment of public health burden of energy in the US during the last decade. And we found that the buildings are now central to both climate and health impact. But we didn't want to stop there with just a retrospective assessment. We wanted to be able to make a forward-looking tool that can help decision-making in building and energy industries and also inform climate action policy planning. And that was the motivation behind COBE Projection tool, which we developed to project out health and climate impacts of energy conservation in building sector into 2050. And we used COBE Projection to investigate impacts of different climate policies in building sector. We implement a framework that brings together different pieces that underline climate and health and energy modeling assessment. Specifically in building sector, climate policies usually focus on more energy conservation or renewable energy penetration and mandates. And these mandates can lead to reduction in greenhouse gas emissions. And using social cost of carbon, or SCC, which is developed by EPA, we can quantify climate benefits in monetized terms. The reduction of energy demand can also lead to reduction of criteria air pollutants. And we can use air pollution transport and health impact assessment modeling to quantify the averted health impact endpoints. And using health valuation methods such as VSL or value of a statistical life, we can quantify the monetized health benefits. And since residential and commercial buildings are the sectors with the largest share of energy consumption, recent climate policies do focus on buildings. An example of one of the most aggressive climate policies in the US is New York City Local Law 97, which has the goal of reducing the citywide CO2 emissions 40% by 2030 and 80% by 2050. And to be able to achieve that goal, they are mandating certain buildings in New York City to reduce their greenhouse gas emissions. Because we wanted to be able to look at the projection of health and climate co-benefits of implementing this policy, we first set out to develop a novel New York City building energy use profile based on LL97. And to do that, we used New York City building stock and building energy use benchmarking data from New York City to develop this baseline from 2018 in terms of energy profile for New York City. And then we used Energy Information Administration, AEO, reference case projection, to be able to develop the energy use projection for the buildings in New York City that are covered by local law 97. We also projected the CO2 emissions from energy use in these buildings. The annual CO2 emissions starts from about 65 million metric tons in 2018. And according to our projection, it goes down to around 48 million metric tons in 2050. And the cumulative projected emissions between the years 2018 to 2050 are about a little bit less than 2 billion metric tons. We also projected the criteria pollutants that cause health impacts, including primary PM2.5 and NOx and SO2, which are PM2.5 precursors. In 2018, the NOx emissions are about 64,000 metric tons, and SO2 emissions are about 12,000 metric tons. The primary PM2.5 emissions are 4,000 metric tons. And these emissions go down by 2050. For example, by 2050, the NOx emissions are about 41, SO2 emissions are about 7, and PM2.5 primary emissions are about 3, all in 1,000 metric tons. We also projected the climate impacts using 3 different discount rates of 5%, 3%, 2.5% to have low, mid, and high estimates for climate impacts. And you can see that the projection of monetized health impacts from CO2 emissions starts from about $3 billion US, and I'm coding the mid estimate here, and it goes up to about $4 billion US in 2050. And it's worth noting that even though CO2 emissions were shown to, in our projections to decrease, the climate impacts are increasing throughout the years. And that's because of the rate of increase in social cost of carbon is faster than the decrease in CO2 emissions. The total health impact, the total health cost of exposure to the projected emissions from the criteria pollutants are also projected in our model that are shown to be about 140 to 411 billion US cumulative in 2018 to 2050. And the attributable mortality cases are between 12 to 35,000 death cases. You also see that there is a variation in health impact assessments that we had from 3 different reduced complexity models of IMAP, AP2, and easier. And that's due to the different assumptions about chemistry and atmospheric modeling in these models. And we know that buildings are central to climate plans. And we just look at the projection of health and climate impacts from local law 97. But the way that local law 97 is designed is it sets goals for the emission reductions for buildings to achieve, but it doesn't prescribe specific pathways. However, there are policies that do focus on specific pathways. And one major example of that is California's residential solar panel mandate. And according to this mandate, all new residential construction in California are required to be built with solar PV panels starting in 2020 to be able to meet their annual electricity demand. And we wanted to look at not only the projection of health and climate co-benefits of implementing this policy in California, but also looking at the what-if case scenario of implementing a similar policy in the larger census region surrounding California, which is Pacific region. And here we have the projection of CO2 emissions and also NOx and SO2 emissions in 2 different scenarios of business as usual, and also in the policy scenario where solar panel mandate is implemented in California. And a figure in the left shows the annual CO2 emissions, and we see that the solar panel mandate can result in cumulative of reduction of nearly 40 million metric tons of CO2 between 2020 and 2050. And for NOx and SO2, these reductions are about a little bit under 30,000 metric tons for NOx and about 4,000 metric tons for SO2. And these reductions of emissions are even much higher than this if this policy is implemented in Pacific region. Reduction of those emission results in health and climate co-benefits, which we also projected here. And here in the left, you can see the projection of climate impact co-benefits and health co-benefits. In the right figure, you can see the annual energy cost savings as a result of implementing this policy. The projected cumulative health co-benefits between 2020 to 2050 are projected to be more than $600 million in California. And the projected cumulative climate co-benefits are about more than $4 billion in California. And considering health and climate impacts and savings that we can see here, the social return of investment from these sustainable projects, such as solar panel installation mandates in California, can improve. But we saw in our results that the improvement in the SROI are different in different locations. For example, that improvement was higher in the Pacific region. Another interesting finding was that when we look at the relationship between the climate co-benefits and health co-benefits, in California, climate co-benefits are much higher than health. However, in other regions, for example, in New York City, that was the opposite case. It underscores the impact of location. And this finding is in agreement with another study led by my co-author, Dr. Buneker, that showed location of renewable deployment determines the health co-benefits. So to wrap up the conclusions and the summary of the findings from our study, we showed that we developed the tool called COBE Projection to project out health and climate co-benefits of different energy conservation pathways. And we saw that both supply and demand sides matter in buildings and can result in significant health and climate savings. And we should consider pathways that consist of both energy efficiency and renewable energy penetration. And considering health and climate impacts can improve the social return of investment in climate policies and projects. And it can also catalyze implementation of these policies because it can demonstrate the outcome of health, which is more salient to people. We also found out that location matters. We saw how the proportion of health savings and climate savings from 1 unit of energy savings can be different in different locations. Therefore, it is important to be able to prioritize energy conservation pathways for not only savings in energy, but also for health and climate by looking at different pathways, different renewable scenarios, energy efficient scenarios, and also in different locations, and prioritize those. So that's one of our main steps, which is a larger umbrella tool, which we call COBE Pathfinder, which includes this COBE projection as well. And we also would like to build new reduced complexity models to integrate NO2 and ozone, and also integrate the Falcon curve that we're very excited about. And my colleague, Dr. Buneker, is presenting that paper, which is, I encourage you to check that out. It's paper ID 199, presented in this conference as well. And with that, I would like to thank you all for your attention to this presentation. And